you the skill of NG tube insertion. As always, we want to verify the physician's order prior to beginning. We always want to enter the room and introduce ourselves to the patient and identify them using 2 identifiers. Provide for privacy and explain the procedure to the patient. We want to ensure that the patient understands prior to beginning NG tube insertion. Always wash your hands and apply clean gloves. We'll want to put our bed in high Fowler's or 45-degree angle and have our patient sit up for this procedure. We're going to drape a towel or a absorbent pad across the patient's chest. And lower our side rib so that we can reach our patient. You'll want to have an emesis basin, your NG tube, some lubrication, and your pH level test kit. And then we also have a piston syringe to withdraw our fluid to test once we have inserted. If your patient is awake and alert and able to drink, we would want to have a cup of water with a straw so that they can swallow during this procedure to make that easier. So to begin, we're going to take out our NG tube. And we also have paper tape to place on the tube once we insert that. So I'm going to take the tip of this and I'm going to measure from the tip of the patient's nose to the tip of the earlobe to the patient's xiphoid process. Once I find that place, then I know this is where my tube needs to insert to. So I would place a piece of paper tape here just to mark my spot so I know where exactly to place that whenever I insert the tube. We're going to insert this into the lubrication and lubricate that well prior to beginning. Assess the patient's nares and decide which nair would be the best for inserting. As I said, we'll have the patient sit up, and to begin with, we're going to have them tilt their head back slightly. And for this one, we're going to insert here in the right side, so I'm going to begin after I have lubricated. And I'm going to start this into the patient's nair slowly. And once you can tell that you've passed into the mouth, we'll ask our patient to bend their head forward towards their chest. And we're going to continue slowly inserting and ask the patient to swallow water if they are able to do that during this procedure. We're then going to continue inserting this until we reach our piece of tape that we have marked. And at that point, we want to secure that to the patient's nose. Once secured, we can open this up and take our piston syringe, remove our cap, and we're going to withdraw fluid or stomach contents to ensure that we're in the proper spot. And then we will place that onto our pH and compare that with our fluid. For verification of insertion of an NG tube into the proper place, we always want to get a physician's order for an x-ray just to verify that we are in the stomach. And then once verification is complete, we can begin our physician's orders, whether that be for suctioning, for lavage, or for tube feedings. Once you are complete, ensure that your patient's comfortable and that their needs are met. We'll lower our bed, we'll wash our hands and clean up, and we are good to go. We always document how the patient tolerated, the contents, the color, the consistency of what was received once we checked the stomach contents.